speaking of sleep evaluation, sleep study, there is a zero uh, component of blood pressure monitoring at present time. Whether you undergo sleep studying in a sleep lab, uh, or whether you undergo home sleep test, in whatever form, as of right now, there's no component of blood pressure monitoring embedded to it. So we don't even have that information about blood pressure to begin with. Um, but as I just mentioned, the field has come to recognize the importance of blood pressure at nighttime in sleep because it's tightly linked to cardiovascular outcomes. Caretaker is very unique in that it's something that you can wear at nighttime with minimal discomfort. And I actually have tried this in some of my patients. They've tolerated this very well. Um, and the quality of the signal from the device has been very good and excellent. Um, and very interesting that in some of these uh, studies that I was involved, patients who wore this device afterward, uh, first question they asked me is not about their sleep or their sleep apnea, but their first question is, what was my blood pressure like at nighttime? So that really struck me, that people understand the importance of blood pressure. And unfortunately, this is not something that we do right now. There are some other technologies and means of doing this, but to my knowledge, it has lots of challenges with those technologies. So Caretaker has a great potential to be adopted to sleep as part of sleep evaluation. But even beyond sleep evaluation, it has a potential to be incorporated as one of the means to assess one's cardiovascular prognosis, just as a standalone measurement. And so now with this device, of course, we will have a luxury to see beat to beat blood pressure data, which is something that's probably we're not used to. So this will give us a fresh set of eyes where we will have to find out how to interpret this data. But I'm excited because at least it will give us, it gives us a dense amount of blood pressure data. And I'm personally working on how to better characterize these beat-to-beat blood pressure measurements so that we can generate something that's meaningfully communicated to clinicians and patients. So I'm very enthusiastic about the technology, and I think especially in the context of monitoring and cardiovascular prediction, I think this has a great promise.